We are going to be talking about Module H, which are the body systems. And as we're going through each of the body systems, we're going to be identifying the structure and function of the cells, all the various symptoms. We've got integumentary, musculoskeletal, nervous, cardiovascular, respiratory, digestive, urinary, reproductive, endocrine, and immune systems. We're going to be talking about your role as nurse aides in the provision of care of residents with cancer. We're going to discuss changes that are associated to the various body systems that are related to aging. We're also going to compare and contrast normal findings and variations of normal findings of the various systems as well, common disorders that you'll find in each system, and your role as it's related to caring for residents and how it relates to each particular system. So the first thing we're going to talk about is cell theory. So what's important to know about cell theory, and this is just going to be a basic breakdown of each system in cell theory. When you get into classes like anatomy and physiology and pathophysiology, you're going to be diving much deeper into all of these systems. So cells are the basic unit of all living tissue or organisms. All living organisms are made up of cells, and cellular function is an essential process of living things. And cells have several functioning structures called organelles that carry on the work of the cell. Our cells are the building blocks of the human body. They have the same basic structure, function, size, and shape may differ though. All cells need food, water, and oxygen to live and function, and they're microscopic in size. All of our cells also divide, grow, and die, renewing tissues and organs as they do so. Our cells also reproduce for tissue growth and repair in an orderly manner. And we'll talk about in a minute what happens when that manner is not so orderly. So our cells combine to form tissues. Oh, sorry, I didn't have that slide up for that one. So our cells, like I said, come together to form tissues. And these tissues are designed to carry out a particular function. So there's a couple of different types of tissues. There's epithelial, connective, muscle, and nerve. Epithelial tissues cover internal and external body surfaces. These tissues line our mouth, our nose, our respiratory tract, our stomach, make up our skin, hair, nails, and glands. Our connective tissue anchors, connects, and supports other tissues, and it's located in every part of the body. Bones, tendons, ligaments, and cartilage. Blood is also a form of connective tissue. Muscle tissues, these stretch and contract to let our body move, and our nerve tissue receives and carries impulses to the brain. All of our tissues combine to form organs or group together to form organs. An organ is made up of tissues, and it may be several types of tissues. Our organs carry out special functions, for example, the heart, the stomach, the bladder, and some of our organs are paired, like the kidney and lungs. All of our organs combine together to form a system. A system is made up of groups of several organs that function together for a specific purpose or purposes. And our organs combine together to form an organism. Our systems of our body, and that's what we've been talking about, the body systems, include our urinary, musculoskeletal, nervous, respiratory, cardiovascular, digestive, integumentary, endocrine, and reproductive systems. So in summary, we've got a nice little image here for you all. Cells, the basic unit of body structure, come together to form tissues. Then those tissues come together to form organs, and our organs come together to form systems. It's normal for our tissues, our cells to grow and divide, and our tissue growth and repair to happen in a controlled and orderly manner. When we have a variation from normal in our cells at the cellular level, this is when we see things like cells growing and dividing out of control, developing into masses or clumps of cells. So you may be familiar with this, of course, like a tumor, right? A tumor is a growth of abnormal cells, and tumors may be benign or malignant. When they're benign, it means they're non-cancerous. They do not typically spread to other parts of the body. They may grow large, but they're non-life-threatening, and they don't grow back when they're removed. Versus malignant tumors, these are cancerous. They invade and destroy nearby tissues. They can spread to other parts of the body. That's when you've heard the word metastasis or metastasize, by breaking off and traveling. They may be life-threatening, and they may grow back when removed. Malignant tumors can occur almost anywhere in the body, but some common ones that we tend to see again and again: skin, lungs, colon, breast, prostate, uterus, ovary, bladder, and kidney. So cancer. Cancer is the second largest cause of death. And the National Cancer Institute describes some risk factors that may contribute to the development of cancer. Age is one. Getting older is actually the most important risk factor in developing cancer. So the longer we live, the more likely it is that we're going to develop a cancer of some sort. Tobacco. So whether you're actually using tobacco, smoking, chewing, dipping, or if we're around secondhand smoke. Radiation, and this can be sunlight, x-rays, or radon gas. Infections like certain viruses and bacteria. Examples of that may be HPV, hepatitis B and C. Those types of infections can be a risk factor for cancer. In addition, certain immunosuppressive drugs, because they lower the body's natural defense for stopping cancer from forming. Alcohol, diets that are high in fat, that high in red meat, etc., those increase the chances of developing certain types of cancers. Hormones, for example, female hormones can lead to certain types of cancers or put us at higher risk. Obesity, certain factors in the environment like air pollution, secondhand smoke, and asbestos. And there's actually a cancer is this, oh my gosh, an acronym. I was having trouble thinking of the word. An acronym for the 7 warning signs of cancer. Now, just because you've had one of these before, or a change in your bowel and bladder habits like that first one, doesn't mean you have cancer. But if you see these signs, these are things that we need to be reporting to our nurse. So cancer, C, is a change in bowel or bladder habits. A is a sore that does not heal. U, unusual bleeding or discharge from any body opening. T is a thickening or lump in the breast or elsewhere. I, indigestion or difficulty swallowing. O is an obvious change in a wart or mole, and N is nagging cough or hoarseness. Now, there are several different cancer treatment options. The goal of treatment is to cure or control or reduce the signs and symptoms of the disease. So if we cure, that's removing the body and killing cancer cells, right? Controlling it, we're helping the residents to live longer. And then reducing signs and symptoms from disease, not only disease, but treatment as well. Because one of the, at least when I think of side effects of cancer treatment, a lot of what I think of is like nausea, vomiting, decreased appetite. So when we're treating patients for cancer, part of it is going to be, again, easing those symptoms and reducing those symptoms and symptoms of cancer treatment. So the key is to find cancer early. That's going to give us the best chance of survival and of treating and curing. Different types of treatments can include surgery, radiation, chemotherapy, hormone therapy, stem cell transplant, and other alternative therapies as well. How we treat cancer is dependent on the type, site, size, and if it is spread or not. Often, more than one type of treatment can be utilized. Side effects will depend on the type and the extent of the treatment as well. So we're going to talk a little bit about a couple different types of treatments. Radiation, this kills cancer cells using X-ray beams aimed at the tumor or the radioactive material implanted at or near a tumor. Some side effects of radiation therapy: the site is often going to be sore, irritated, red, and blistered. So you can imagine that's not very comfortable. If the radiation is near the head or neck, you may also see dry mouth and sore throat. Often it's going to make your residents tired. It's going to cause discomfort for those reasons we mentioned. For one, nausea, vomiting, diarrhea, and loss of appetite. So we need to be aware of safety needs for healthcare providers and visitors as well because of radiation, not only to the patient, but we can suffer the effects of the radiation as well for not using proper precautions. Nurse aides care directed it, the nurse aide's care, is directed at minimizing side effects and providing emotional support as someone's going through radiation therapy. There's also chemotherapy. This affects the whole body, both cancer cells and normal cells, though there are some targeted therapies these days that can be given that know how to tell the difference between a cancer cell and a normal cell, which is pretty amazing. Chemotherapy may be given orally or intravenously, which may require a port. So sometimes if you've seen someone with a port, this allows that port to be accessed for therapy repeatedly over time. So we're not having to continuously stick these patients. We need to be aware also of safety needs for healthcare providers and visitors. There may be special personal protective equipment that we need to wear or special ways that we handle equipment when someone has been going through chemotherapy. Side effects of chemotherapy will depend on the drug, but some of the common ones that we may see are hair loss, also known as alopecia, digestive disturbances like that poor appetite, the nausea, the vomiting, the diarrhea, stomatitis, that's inflammation of the mouth, decreased blood cell production, which can result in these patients and residents being more likely to bleed and also develop infection. They're going to feel weak and tired. Some of these drugs are going to affect the way our residents can think and store memory and recall memory, and emotional changes are likely. Some targeted chemotherapy, which we mentioned is sometimes an option, can also raise blood pressure, so that might be a side effect that you have. So again, just like with radiation therapy, our care as nurse aides is directed at minimizing side effects and providing emotional support. Overall, our role in caring for residents with cancer, we need to understand that these residents' needs are going to include pain relief or control, rest and exercise, adequate fluids and nutrition, and prevention of skin breakdown is a real big one. Also, another one is preventing bowel problems, right? Whether it be diarrhea, constipation, dealing with the side effects of treatment, and the psychological and social needs and spiritual needs as well. So we need to understand that each case, each resident with cancer is different. Some residents may live for several months. Some residents may live for years. And knowing that treatment affects each resident differently. So we never want to make assumptions about a resident or their treatment. When it comes to social interaction, residents may want to talk and some may not. So listening is going to be really important. Some may just want to share how they're feeling or their experience, but we don't want to be pushing them to talk about it if they don't want to. We want to be honest, sensitive, and positive. If we notice that they're, doing a better job of taking in adequate nutrition and fluids, be encouraging and supportive. Proper nutrition, as we mentioned, and pain control, these are all important things for us to be aware of and encouraging. So when it comes to nutrition, follow the care plan, encourage variety of foods. Often for these patients, smaller portions is ideal because their appetite is poor. They suffer from the nausea and the vomiting. So sometimes if we can space out and do smaller meals more frequently, that's really helpful. And actually, while residents are receiving chemotherapy treatment, metal utensils can actually sometimes cause a really unpleasant taste in their mouth. So sometimes offering plastic utensils for these residents is really beneficial. When it comes to pain, we want to watch for signs and report that to the nurse right away and provide comfort measures that we can do, such as repositioning, distraction, pillows, etc. Assist with comfort and circulation. So we can use different positioning devices, assistive and adaptive devices that we've talked about, helping these patients to reposition every 2 hours, especially if they're weak and immobile. As far as skin care, we want to really watch for signs of pressure injury, always keeping the skin clean and dry. If there are any markings of any kind, such as for radiation therapy, we don't want to wash the markings off, and we want to avoid applying lotion or anything really directly to a radiation site. Mouth care, patients who are going through these types of therapies, radiation, chemo, different medications, they're going to need good mouth care. So we want to make sure that we're, encouraging that mouth care, assisting as needed, even offering the oral swabs to help with mouth sores or with dry mouth. That can be really beneficial. If we notice any of the following, we want to make sure that we're reporting to the nurse right away. Increased weakness, tiredness, fainting, nausea, vomiting, diarrhea, changes in appetite, confusion or changes in mental state, blood in the mouth, urine, or stool, changes in the skin. If we see any new lumps or sores or rashes, or if we notice an increase in pain or pain that's not being relieved by the medication that the nurse is giving. Also important to remember that self-image it can be a concern with these patients and residents. A lot of times they're going through a change in appearance, like the hair loss. So we want to we want to assist with grooming, show concern and interest, and help them in whatever might be beneficial to them. Like in this image, if they want to wear a headscarf, assist them in getting these things, right? So visitors and families, if the visit is a positive one, you don't need to intrude, give them their space and their privacy. Often there's support groups in the community for patients who are going through cancer and cancer treatment. So we can offer suggestions or suggest to the nurse that they might want to add that to the care plan. Now, one thing we want to be aware of is if we notice that any of the interactions with whether it be family or friends are not positive, or when the family or friends leave, if our resident or patient seems to be in more distress, this is also something that we're going to want to bring to the attention of the nurse so that they can address it appropriately. These patients really need time to rest and heal, but they do also need the positive interaction with visitors and family, again, if it's a positive one. All right, so that concludes the cell theory portion of Module H. So I'm going to stop the recording now, and then our next module will be over the integumentary system.